Hi, welcome to Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and Chief General Surgeon here at Conneaut Medical Center. Doc, how you doing today?
Oh boy, I can't complain. Love this weather.
I know, fall is here,
oh,
Doc.
Oh gosh, after the summer we had, it feels so great.
I just wanted to mention to you that we have been getting questions, which we encouraged from our viewers out there.
That's a big part of what we're doing is...
And I thought maybe we could have a special show just with questions that you could answer for us.
Absolutely. You know, we've done. That's what we used to do on the old AM
yes.
all the time. And
at least once a month,
like that. And,
yeah.
And at our next program, we'll definitely. And we do encourage all of you to please, if there's anything that you have questions about, that you're concerned about, would like to know more about, just let Pat know. And we'll pick them up here and we'll answer them on the air. That's great for us to be able to do that for everyone.
So we encourage you to do so. So you have a guest today, Doc.
This is a big deal for our area. Okay, we have with us Dr. Yilmaz, Dr. Turker Yilmaz.
Thank you.
Who is an ear, nose, and throat surgeon, and he is based in Ashtabula.
Yes, correct.
He sees patients from Conneaut, Geneva areas, Ashtabula, of course. To have ENT out our way, we've been waiting for this man for a long time. He is going to talk to us a little bit about what brought him out here, what kinds of things he does, and I think this will probably be the first in I'm hoping, a series of appearances by Dr. Yilmaz to discuss problems, conditions that he sees and that he takes care of. Again, along with our philosophy, the more you know and the more you understand this kind of stuff, the better you're going to be prepared to be able to make sure you get the care you need at the time you need it. So you have just joined UH fairly recently?
Yes, sir. And thank you for inviting me and giving me this opportunity to speak to the public. I would like to say hello to everyone. My name is Turker Yilmaz. I came from Boston, Massachusetts. I'm an ENT physician, and besides being a general ENT, I have subspecialty training in nose and sinus diseases, and besides that, I'm a certified pediatric ENT physician as well.
Pediatric?
Yes, sir.
Wow. Okay. Folks, I think it's probably fair to say that any well-trained ENT doc can probably take care of kids, but if you have a fellowship and special training, because the anatomy is a little different, the conditions are a little different, it's really a kind of a different world. Isn't that true?
Yes, that's true.
All right. So to have that level of expertise for our kids out here is we're really lucky to have that.
Thank you, and I'm happy to be here. I like this town. I like to serve the community. I think there are great people here.
Your office is in Ashtabula?
Yes.
So you see people basically from all of Ashtabula County?
Yeah, right.
And
I'm covering Conneaut, Ashtabula, and Geneva.
And Geneva. Now, I think the way that it's working out is that if a person needs an ENT procedure done in an operating room, that would probably be done in Geneva. Is that right?
That's right.
And folks, here in Conneaut, that's a whole different matter than driving even to Geauga. It's a lot easier to drive to Geneva than it is to drive to Geauga, let alone Cleveland. So that means that we have ENT care close to home now. When are you in your office?
Well, currently I'm in my office on Monday, Tuesday, Wednesday, and Fridays. Thursdays are my surgery days for now, but this may change. But for the time being, I'm doing 4 days a week.
And again, folks, Dr. Yilmaz is going to talk about what an ENT doctor is and what he does and so on. But you'll be seeing you're seeing his telephone number on the screen, and you can call him.
Sure.
If you have an ENT problem, you can call his office. You can talk to your primary care doctor about it, that's fine, but you don't need a referral. You can call directly if you want to talk to the expert, if you
Yes.
want to be seen by the expert.
Sure.
Okay, so what is an ENT doctor?
Well, basically, ENT is the short form of ear, nose, and throat, and we deal with hearing problems, balance problems, ear infections, nose infections, sinus diseases, and throat problems, and also some tumors related to ear, nose, and throat, and head and neck. We see pediatric patients and adult patients, but I'm a certified pediatric ENT, so that's a kind of subspecialty training. And we pretty much cover almost everything on your head except your eyes, basically.
Doc, you hear a lot these days about polyps in the nose. I know several people have had problems with that. What causes those? And
Good question. Well, actually today I'd like to talk about nasal congestion, and part of the topic is nasal polyps.
Okay.
I'm going to talk about that as well.
great.
So today's topic is nasal obstruction, causes, results, and treatment of nasal obstruction. So our nose is located between our eyes in the middle of our face, and normally it's about 4 to 5 centimeters in length. But you see this picture here. So this guy holds the Guinness World Record for the longest nose in the world. It's about 12 centimeters.
It's a big nose.
It's a really big nose. All right. So a brief anatomy of the nose. Our nose consists of nasal passages on both sides, on the right and left, and our sinuses are connected to our nose. And the side wall is not straight. There are shelf-like structures on the side wall. We call them turbinates. We have 3 of them on each side, and at the very back side of our nose, we have the eustachian tube going through and going towards our ears, basically. And our nose is responsible for a variety of functions. It's responsible to humidify air, to warm the air, and also it traps the foreign objects from entering the lungs. It's a kind of first-line defense mechanism for our body. So if a germ or a dust or an allergen enters our nose, it gets trapped in the mucociliary system. So cilia are like little hair-like structures located in our nose. And these bacteria, and this is a scanning electron microscopy picture, gets trapped in that mucociliary system in this case. And also our nose is responsible for smelling function. So the olfactory nerve sits at the roof of the nose, and its fibers extend through the nose, and we smell a bunch of a variety kind of different scents. Do you know how many different types of scents can we see, can we actually smell? Can you guess how many different types of scents a human nose can sense?
It would be a lot.
Well, it's about 1 trillion. So our nose is responsible to sense about 1 trillion scents. Okay.
And of course, that has a lot to do with what food tastes like.
Exactly.
Because the basic tastes on the tongue are pretty primitive. But the real subtlety of the flavors of nice meals and so on, you have to have normal nose function to
right.
be able to appreciate that.
You're right. Well, yes, if your nose is blocked, you have a diminished sense of taste. When you have the food in your mouth, it also goes to your nose, and you have an olfactory referral. So you have a better understanding of the food, a better taste of the food in your mouth. So it also serves as a tasting organs, besides being a smelling organ. Also, our nose helps us with our speech. If our nose is blocked, our phonation is limited. If a kid or an adult has flu, let's say, nose is congested, and as you know, you can produce a funny sound like this. So it also serves with our speech and phonation. And besides that, also nose helps with our hearing. As I mentioned, there's a tube connecting our nose to our ears, eustachian tube, and if that tube gets blocked, our hearing is kind of
Now, I've had people
blocked.
tell me that they, for example, have gone in an airplane
Yes.
And then they land, and they're waiting for their ear to what they say pop. I'm waiting for my ear to pop, and their ear doesn't pop, and they really have trouble hearing. Is that the eustachian tube there that's implicated in that?
Exactly. So the air pressure changes depending on the altitude. Air pressure basically means the weight of the air above us. There is about 10 kilometers of air above us, but when we take an airplane and go up to the sky, so the air pressure above us decreases. And when we land, suddenly the air pressure increases. And if we have a blocked eustachian tube, our nose cannot hear for a long time because of barotrauma.
It can't really equalize.
It cannot equalize the pressure on both sides. You're right.
Okay.
So this is also related to nasal congestion.
I've only flown once, but and it was a long time ago. But I had that where the ear did not pop. It was like 3 weeks of that congestion.
Yeah, it's really annoying.
Yeah, it's terrible. Yeah.
Oh, yes, in that case, I mean, you may need to use a nasal decongestant spray. Basically, over-the-counter stuff may help you, or in severe cases, you may need to see an ENT doctor.
Yeah, this person that I knew, I mean, it was very troublesome. He tried conservative things, didn't work. So he went to see an ENT doctor, and he had just a little laryngotomy tube and solved the problem instantly.
Yeah, that's one of the great things. Well, I would like to talk about some common causes of nasal congestion. So as almost everybody knows, allergies are one of the most popular, most common causes of nasal congestion. And as well as allergies, there may be deviated nasal septum and enlarged turbinates. They generally come together. Both of them may happen at the same time, generally. And chronic sinusitis is another problem, and nasal polyps are another problem, as we mentioned. And benign and cancerous tumors are another problem, but relatively they are less. So let's start with allergies. Allergies are quite common in the United States. About 7 to 10% of the kids in our society have allergies.
It's a lot of kids.
And it's on the rise. For the past 5 decades, allergies are rising. Why is that happening? There are different theories. One, breastfeeding has declined, and breastfeeding helps really the kids to have less allergies. And secondly, there are lots of antibiotic use. Perhaps some of them are unnecessary. And if you use too much antibiotics on kids, their immune system kind of forgets to fight bacteria, or doesn't want to fight bacteria, but it wants to fight something, and it fights the allergens. And third theory, there are lots of chemicals in our daily life, in food, in our environment, everywhere basically, and that might be a source of allergy as well.
I want to amplify or go back to a point that you just made. We've made this point on this program more than once, and I think it's really helpful for people to understand that antibiotics are a double-edged sword. Okay, it's I would say expected that, okay, I've got this. I think I've got an infection. I have a cold. Okay, and I go to the doctor and I expect to get antibiotics, and that's very, very common.
Yeah, right.
And to the point that people feel like, well, I'm really not being treated properly if I don't get a prescription. But that may well not be true.
You're right.
A lot of these things are caused by viruses, and antibiotics don't treat viruses.
Yes.
But every time you take an antibiotic, you're helping to select bacteria that can resist it, for one thing. And the point that you just brought up about kids getting antibiotics and then having their immune system such that we see problems with allergies, I hadn't heard that before. That's very, very interesting. So it's really good for the public to realize, yeah, antibiotics, when you need them, they're fantastic, they're essential, but you don't always, and if you take them when you don't need them, you're setting yourself up for problems. It's good to know that.
Right. Right.
Okay.
And if allergies stand for a long time, for months to years, especially if you have allergy against house dust mites, these long-standing allergies may form a continuous edema in the nose, and this continuous edema finally
That's a
leads
swelling. That's a kind of a swelling.
Yes, this swelling finally leads to polyp formation. So polyps are benign masses.
So they come from chronic swelling, from inflammation, from stimulation, like from allergens.
Exactly.
That's where the polyps come from.
Yes,
Okay.
yes. So chronic stimulation, allergic stimulation leads to polyp formation. And polyps are masses in the nose. They tend to diminish the airspace, block the nose, may cause sinus disease. And may
Now, based on the epidemiology of polyps, how many people, what percentage of people do you think are walking around with nasal polyps?
Well, it's hard to say, but if a patient has...
Is it common?
If you have chronic allergies, you can suffer from polyps. If you have, high sensitivity against house dust.
So people who are sniffling, people who, oh, it's my allergies again, people who have that kind of a problem fairly frequently, they're at higher risk for polyps.
Yes, and should get checked for polyps.
And should get checked for polyps.
Yes, you're right.
All right, that's good to know.
And so you see a polyp here. This is the septum, this is the lateral nasal wall, and this is the polyp in between. This is a typical view of an allergic patient's nose. The view of the mucosa is pale and severely congested. See, the lateral wall touches the middle wall. There's very little space here. All right.
So that person is going to really be sniffling and congested.
Sure, of course.
Okay.
And next thing I would like to talk about deviated nasal septum. So this is also a fairly common condition. A study estimates that about 80% of the people may have some sort of deviated nasal septum.
So you can have that without a history of trauma?
Well, yes. Actually, you may not know that you had the trauma. Some of the trauma may happen during birth. And a study investigated about 249 infants, and about 50 or 40 or 50 of them had some sort of deviation right after birth.
Wow.
So passing through the ear, so birth canal may be a trauma, or the baby may have a trauma in, in the pregnancy period. So it's.
Oh my goodness.
It's a trauma that you may not remember.
Right.
Might have happened long time in the past. What's a deviated septum? The septum is the wall separating two nasal cavities. It's cartilage at the front side, and at the back side it's bone. We expect nasal cavities to be symmetrical and septum to be at the midline, but in some cases the septum is deviated somehow. And if the septum gets deviated to one side, the turbinates, the shaft-like structures on the side wall tend to swell and fill the space. So if you look at the CT scan, the septum is deviated towards the right, to this side, let's say in this picture, kind of. It's actually towards the left, I guess. Anyway, the septum is deviated towards one side, and the turbinates are swollen on the other side. So this is quite typical. Septum is deviated to one side, and turbinates on the other sides are chronically congested, swollen. And this is a condition that can be corrected surgically. It's a simple surgery, actually. I'm going to talk about that later on. And next, chronic sinusitis. Chronic sinus disease may happen together with deviation. So this is a CT scan of one of my patients that I recently operated. She's a Conneaut resident, actually. And we see that the sinuses, maxillary sinuses, and the ethmoid sinuses are chronically inflamed. This gray stuff is the chronic inflammation. And the septum is deviated to one side, and the turbinate is hypertrophied, and there's turbinate hypertrophy on the other side. Sinusitis is also a common condition. It affects about 37 million people each year, and it's more prevalent than heart disease and asthma in the United States. And next, tumors. So we again see a CT scan of a patient. So these are eyes basically, and this is the nose on one side. It's and the sinuses. They are clean, no problem with them. But on this side, you see this tumoral mass here, bulging and invading the bone and protruding towards the nose. Let me show it to you too. So tumors are relatively rare. About 2,000 cases happen in the United States each year. So it's not a very common cause of nasal congestion or obstruction. And next, I would like to talk about the consequences of nasal congestion. So what happens if your nose is congested? What happens if your nose is blocked? So first thing, you have loss of smell, right? I mean, if your nose is blocked, you cannot smell very well. And secondly, you have a loss of taste. And if you cannot breathe through your nose, you breathe through your mouth, and then you have a dry mouth, especially in the morning. And if your nose is blocked, you have a lack of concentration. This is pretty common, right? I mean, if you get flu, if your nose is blocked, you don't feel that energetic that much. You have a diminished concentration, diminished attention. It happens. And also, if a kid has a chronic nasal congestion due to adenoid hypertrophy or chronic tonsillitis, the kid also may suffer from ADHD, attention deficit hyperactivity disorder.
That's fascinating. So in some cases, if a kid is having problems at school with attention deficit, that kind of thing, and they have a nasal problem that gets solved, that can really help as far as the...
Yes.
That's amazing. That is amazing. I'm sure that there's people listening right now who have kids or who know of kids where this is a problem and might be prudent to get their noses checked out.
Sure.
I wanted to ask you one question, going back to the polyp thing. Now, you have when you have polyps, you have to have them removed, right?
Right. But before the surgery, we generally prescribe a course of oral corticosteroid. Corticosteroids shrink the polyps.
Really?
Yes, it helps. I mean, it may not cure the polyps, but it reduces them in size, and it makes the surgery easier with less bleeding.
Once they're removed, can they come back?
Well, they can. It's a kind of chronic disease because it's based on allergy. And
Right.
allergy is a kind of chronic disease. You know, there are some sort of diseases chronically, like hypertension or diabetes. I mean, you take some sort of medication and it really helps to control the disease, but they don't cure the disease.
Right.
So allergies, this type of situation. You can take some sort of medication to suppress the disease and you can remove the polyps, but you don't want them to come back. So we generally prescribe a nasal steroid spray and we check the patients. It depends, but it may be every 2 months or 3 months or 6 months. And if they come back, we can simply remove those small polyps in the office.
Okay.
And what else? If we have nasal congestion, we have some sleep problems. Patients may snore at night, and in severe cases, patients may have obstructive sleep apnea, which means patients stop breathing while they sleep, and then they start again, and this is on and off for the whole night, and they don't feel refreshed when they wake up in the morning. And if you have sleep apnea, if your breathing stops, then the oxygen in your blood decreases, and your heart needs to pump blood more efficiently. This puts a significant burden on the heart, and you may have some hypertension. You may have some hypertension problem as well. And if you don't get too much benefit from your sleep, if you still feel sleepy in the morning, you may suffer from some grumpiness. You may see some people grumpy, angry all the time, fat guy, thick neck. And these people may suffer from nasal congestion and obstructive sleep apnea. And also, if you don't breathe from your nose easily, you may have some depression. I mean, you don't feel very happy all the time. I mean, your attention is decreased, your cognitive functions are decreased, and you are kind of depressed. And also, you may have some headache issues as well. If your nose is blocked, you may also have some headache problems.
So it's not just a problem in itself. I mean, it's not just unpleasant in itself. It's tied into a whole lot of things.
You're right, Dr. Bryant, yes. It's a set of, it comes with a set of problems, actually, if you have nasal congestion.
Wow. Well, folks, see, this is why it's such a benefit to our community to have somebody like Dr. Yilmaz with us to bring these things out. This is a problem that is very widespread and that's amenable to therapy. I mean, it can get better. It can get a lot better, and it can impact your life all over the place.
You're right. You're right.
Wow. So this is good for people to be armed with this kind of information, okay? Because people will hear this, and people will think, gosh, you know, I have a problem like that, or my husband has a problem like that, my wife has a problem like that, my child does, and we don't just have to live with it. I mean, we can really get this evaluated, find out what's really going on here, and do something about it.
Right.
And as we mentioned, you know, I mean, if you have questions along these lines, you can call Dr. Yilmaz's office yourself, and he'll check you out, and he'll let you know what's really going on there.
Sure, I'll be happy to do that.
Can you, is there a blood test or something, Doc, where, I mean, a lot of people, like you mentioned, have allergies, especially for some reason in this area, and I'm not sure if it's the trees or the grass or what. Is there tests that can...
Very good question. Thank you for asking that. So there are different types of allergy testing modalities. One of them is blood test. Mm-hmm. If we have 5 milliliters of blood, we can detect multiple allergies. Mm-hmm. It might be environmental allergies, grass, pollen, trees, that type of thing, mm-hmm. and also food allergies as well. Also another type of testing is skin test. It gives us an instant result, mm-hmm. But it may not be easy to do in little kids. So basically we can do skin testing and also blood testing.
Mm-hmm.
That's both of them.
What about animals? Animals can cause allergies.
Yes, you are right. So some people are allergic against cats and dogs, and they don't know about that. They have a constant sneezing problem. They have some nasal congestion, some snoring issues, some perhaps obstructive sleep apnea, and the allergy test yields that they have allergy against their pets in the house.
Yeah.
Boy, that's a tough one to find out about.
Yeah, it is. It is.
And next, I would like to mention, I would like to stress the kids with nasal congestion. So if a kid has continuous nasal congestion, this may cause some teeth problems and facial anomalies. Probably you had seen kids like this with a rabbit-like face. The nose and the premaxilla, the mid-face has developed in a kind of protruding fashion, and their mouth is almost always open like this. So if a kid has some chronic nasal congestion, it may cause some facial abnormalities and also some teeth problems. All right. And what are our treatment options for nasal congestion? So first of all, we can try medical treatment. If it's just allergies, we can try a spray, antihistamines, that type of medication. And also there are some surgical methods as well, like septoplasty, correction of septum deviation, and turbinate reduction at the same time. Endoscopic sinus surgery for the sinus disease and also to remove the polyps, nasal valve surgery, and adenoidectomy for kids. So there are many different types of things that we can do for the patients. Nowadays we generally do the surgeries with an endoscope. So the endoscope is a little tiny camera that goes through your nose, and there is no cut outside, and there is no swelling on the face, not much pain, not much bleeding. It's just a tiny camera that goes through your nose, and we operate inside. So that's pretty convenient. If a patient gets surgery on a Thursday, let's say, a patient may return to work on a Monday.
Wow.
And I would like to talk about radiofrequency also. Some patients are afraid of getting surgery. That's a fact. So radiofrequency, if there is mild septum deviations, mild to moderate turbinate hypertrophy, is an alternative to surgery for those type of patients. What we do with radiofrequency, so it has a probe with a thin needle at the tip, and it gives heat to the tissue. So the turbinates, the shelf-life structures on the side wall get swollen. And we basically stab the needle into the side wall, and we heat these structures at multiple points. And when we heat them, they shrink by time. Perhaps not instantly, but by time they shrink, and we obtain a much larger airspace. One session may be enough. Some patients may need 2 sessions, and some patients may need 3 sessions of radiofrequency. It's pretty easy. We can do it in the office. It takes about 10 minutes, and pain is very little, quite tolerable.
And long term, the outcomes are pretty similar to surgical outcomes? Or? I mean, in terms of efficacy, long-term
You're right.
efficacy?
Surgery has more long-term efficacy than radiofrequency. There's a comparison of surgical turbinate reduction and radiofrequency. So surgical turbinate reduction is more efficient in the long term. But I mean, if you are afraid from surgery, or if you don't have time, you can simply go for radiofrequency.
It's a wonderful alternative to
Yes.
have, sure.
And you may be fine for maybe 1 or 2 years, maybe 3 years, and you can get another session of radiofrequency after that.
Okay, so if you've had it one session and gotten your result, and then you recur, the fact that you've had it once doesn't mean that you can't have it again.
Exactly, you can have it again.
Okay.
But definitely, surgery has a more efficient, better results, and long-standing results. I mean, they are more effective for a longer time.
Okay. Gosh, this is fascinating stuff. I have learned a great deal here today.
So have I. And like you said, Doc, hopefully we can get Doctor in here on.
Well, I'm hoping we can. You know, that this has been an excellent overview of a lot of different problems that you see. There are some that were mentioned that I think the public would benefit if we could go into them in maybe a little bit more depth.
Sure.
If you'd be willing to come back with us another time.
Sure, of course.
Or so.
Yes, sure, of course. We can go into detail into some of these topics.
Okay.
Yeah, that'd be great.
Again, you know, if you have questions for Dr. Yilmaz, you can call his office. You can send the questions to Pat, and we'll make sure that they get answered on a subsequent program with Dr. Yilmaz. So please don't hesitate to do that. Again, I always mention that in a couple of weeks or so, this program is going to be available on YouTube. It's going to be shown on our Conneaut cable networks for a couple of weeks, so everybody will have a chance to see it. But after that, it will be available on YouTube, that you can go up, or if you have people that you know who might really get something out of this information, they can go up to YouTube, and all you have to do in the search is type in "Your Health Matters" and then my last name, Bryant, and all of the shows that we do will pop up on that channel, and Dr. Yilmaz's show will be up there as well.
And lastly, I would like to remind the audience that flu season is approaching. I recommend that everybody gets a flu shot. It's a safe vaccine. You need to get it every year, once a year, and you can get the kids also have the vaccination. It's safe after 6 months of age. Well, we don't recommend it for all elderly. There is a side effect, a neurological side effect that might happen 1 in a million in elderly, something like a Guillain-Barré syndrome, a neurological disease. But between 65 years of age and 6 months of age, I recommended getting once a year.
So for the kids, the flu shot.
Well, yes, especially for the little kids. I mean, 1 year to 5 years of age, I recommend that.
Okay. All right. Well, we really appreciate you taking the time to come out and join us today.
Thank you very much for inviting me, Dr. Bryant.
And again, you know, to have this level of expertise out with us, I know that UH has worked long and hard on this, and now Dr. Yilmaz is here. So
Excellent, excellent. Thank you for coming in.
Thank you very much. Thank you for inviting me.
Okay, remember your health matters. We'll see you next time.